Hi, I'm Chris Weister. I'm the fitness director here at Blaze Sports and Fitness. We have Dr. Seiler here from OSMS to talk about elbow injury prevention.
My name is Jacob Seiler. I'm one of the sports medicine orthopedic surgeons with OSMS. So I have a fellowship in arthroscopy and sports medicine. And accordingly, we're here to talk about some sport and overuse related injuries to the elbow and how we can prevent them. Okay, so the first problem that we're going to talk about is lateral epicondylitis, commonly known as tennis elbow. It is an overuse injury that involves the extensor compartment of the forearm. So extension it allows your wrist to come up. These muscles cross two different joints, both the wrist and the elbow. And so accordingly, there's some variations we can do to target the muscles differently. But the first thing we want to do is stretch the muscle group, right? So to stretch the wrist extensors, the best way to do it is with the elbow in extension. So you extend the elbow out and you want to flex or bend the wrist downward. And if you pull at the long finger or the middle finger, that's kind of the center of the extensor mass of the wrist. And you just want to give a nice gentle stretch, and you should feel this in your elbow. You notice she's a nice full extension at the elbow. She's at about 90 degrees of flexion at the wrist. You feel that in your lateral epicondyle right here? Perfect. So you want to hold for about a count of 10 to 20, just a nice slow count. This is a prolonged static stretch. Okay, so the next stretch we're going to focus on is for medial epicondylitis, which is the opposite of lateral epicondylitis, otherwise known as golfer's elbow. It affects the flexor compartment of the forearm and the inner aspect of the elbow, also an overuse injury. And so, like we talked about in lateral epicondylitis, since these muscles cross two joints, it's often best to target them in different ways. So again, we can start with the wrist out neutral, elbow and extension, and then when we begin the stretch, we're going to be pulling the wrist downward, and you can go ahead and do that, Chris. And oftentimes you won't get that end range of motion like you will in the lateral epicondylitis exercise, but just to the point of discomfort on the stretch. Shouldn't be painful. Again, count of 10 to 20. Now, a second way we can do this is in like a prayer position, right? So we can work on the wrist extension with the elbows in a flexed position. Oftentimes that's an easier stretch, but if you have a really bad case of medial epicondylitis that you're treating, this may be difficult. The last thing we can do is we can get down into all fours and almost like a cat's position with the forearms maximally supinated, and we're kind of leaning into that stretch with the elbows in extension. Again, holding for a count of 10 to 20. All right, so for this next exercise, we're going to push Chris a little bit with a heavier weight than she should probably be hitting. But this is an extension-based exercise. So again, we're targeting the lateral epicondyle. And really, there are two phases of each lift that we're going to talk about. There's a concentric phase, so the muscle is contracting as it's shortening, and the eccentric phase, where the muscle is contracting as it's lengthening. The eccentric phase is usually the most important when you're treating an overuse injury. So Chris will be cognizant as she's letting her wrist to fall back down to a neutral position. She does that slowly. So Chris is going to start an extension. She's going to gently lower that weight, nice, slow and controlled. And then she can come back up into a extended position. And she can also, if you're getting fatigued, you can help that concentric portion and then isolate independently with an eccentric portion. So what that means is if you want to take your other hand, and as you get done with the lift, you can bring yourself back up and then allow yourself to fall single-handedly. And really we're shooting for, depending on the weight you're using, 8 to 12. I would recommend a very light weight for this. All right, rotating over to the flexor surface of the forearm, we're going to do some wrist flexion exercises. So the same thing, this is the concentric phase of the lift, and then we can eccentrically lower down and nice and slowly, pausing at the end range of motion, focusing on that isometric contraction when the muscle isn't changing length can be helpful as well. Again, this is targeting the flexor compartment. All right, so our last exercise today is my very favorite. This is Zottman curl. The Zottman curl, this targets multiple muscle groups at the same time, okay? So we're gonna focus on the biceps and the wrist extensor compartment at the same time. So it's a traditional supinated curl, concentrically bringing the weight up. And as you are about to come down, you pause and then pronate and lower the weight. And so that will focus again on the lateral aspect of the elbow, the wrist extensors, at the same time giving you a nice pump of the biceps. All right, so one disclaimer is that we're focusing again on lateral and medial epicondylitis, which are two overuse injuries. And accordingly, we don't want to create these injuries by overtraining. So these exercises, particularly the strength-based ones we've been talking about today, Chris, we don't want to be doing every day. Certainly, probably no more than 2 to 3 days per week. You want time for that muscle recovery. And again, the stretching portion probably could be accommodated multiple times per week, but we don't want to overtrain the muscle groups.
Well, we'd just like to thank Dr. Seiler for coming today. I really appreciate it.
Very happy to be here, Chris. Yeah.
Awesome, awesome. Have an awesome day.
Thank you.
Thanks for coming.